This is a very common issue that we see at our clinic. You would think it would be simple, just a skin issue on the face, something a cream can fix, but it's not. Rosacea is complicated. Rosacea is frustrating, and if you've ever dealt with it, you already know it. It's not just about redness on your cheeks. It's about the burning, the unpredictable flushing, the bumps that appear out of nowhere, and the way it can unfortunately chip away at your confidence. So today, we're going to talk about why rosacea happens, why it can be so stubborn, and how to finally get to the root of it. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So what is rosacea? Rosacea is a chronic inflammatory condition that tends to affect the center of the face, the cheeks, chin, nose, and the forehead. And in many people, actually, it affects the eyes as well. Rosacea can cause repeated flushing, persistent redness, acne-like bumps, and visible blood vessels. More than half of people with rosacea also have eye symptoms, such as dryness, irritation, light sensitivity, eyelid inflammation, or in rare cases, even corneal problems that can threaten vision. Rosacea usually begins between ages 30 and 50, but it can appear at any age. Globally, about 5.5% of adults are affected, with men and women equally likely to develop it, though earlier studies suggested women were more often diagnosed. And rosacea is more diagnosed and recognized in fair-skinned people of Celtic or Northern European descent, but often underdiagnosed in those with darker skin tones, since redness and these broken blood vessels are harder to see. And I have to say that I see it in our clinic that rosacea is not just skin deep. It can affect self-esteem, emotional health, and the quality of life. And also, rosacea has possible associations with cardiovascular, neurological, autoimmune, and psychiatric disorders. And today we will focus in this video on association of rosacea with GI disorders, and we'll talk about that in a few minutes. One thing that I always explain to my patients is that rosacea isn't the same for everyone. There's what I call a baseline rosacea, the constant low-level redness that never really goes away. And then there is a situational rosacea where your skin looks fine most of the time, but certain triggers like heat, stress, wine, or spicy food set off a flare. So in general, baseline rosacea can sometimes be easier to calm down because it responds more predictably to the treatment. Situational rosacea can be trickier because you not only have to treat the skin, but also navigate the constant outside triggers that can set it off. So let's look at the causes of rosacea from conventional medicine viewpoints. So from conventional medical perspective, rosacea is driven by immune system overactivity and nerve, skin, hypersensitivity. There's also a genetic component. Some people have this genetic predisposition, genetic tendency that makes their immune system more reactive. And there's also an infectious component. Certain skin microbes can act as triggers, especially Demodex mites. So Demodex mites, there are these microscopic parasites that live in hair follicles and oil glands. Also, there are some bacteria like Bacillus oleronius or Staph epidermidis that could trigger rosacea as well. So a little bit of immunology, not a lot, but these microbes can activate special alarm receptors in the skin called TLR2 and PAR2, which trigger a chain reaction. Then skin releases a cathelicidin, which gets converted into LL37, and that's a molecule that sparks redness, swelling, and new blood vessel growth. Inflammation engines inside skin cells, called inflammasomes, appropriately so, release strong inflammatory chemicals that cause pustules, so there's vesicles with pus in it, pain, and blood vessel changes. The adaptive immune system joins in, sending more inflammation-producing T cells, those are specialized immune cells, to the skin. And there is also a nerve connection, as I mentioned earlier. Certain nerve receptors like TRP channels are extra sensitive to heat, sunlight, spicy food, alcohol, and exercise. So when triggered, they release chemicals like substance P and CGRP, which cause flushing, dilated vessels, and more inflammation. So now let's look at conventional medicine treatment. Conventional medicine matches treatments to symptoms. So here's how they're grouped and how they work. So first big group is antimicrobials and anti-inflammatories. And this group includes metronidazole, oral doxycycline, minocycline, ivermectin. And the goal here is to reduce inflammation and control microbes linked to rosacea. Usually the first line of treatment is metronidazole, a topical metronidazole. It calms inflammation and it controls certain bacteria. It actually is very well tolerated, and it's good for acne rosacea if you have acne-like presentation, but it's not so good if all the patient has is just redness, just dilated blood vessel. And it's tolerated very well. It rarely causes burning or irritation unless somebody is allergic, of course. Then we have low-dose doxycycline, and it reduces inflammation at these low dosage, but ultimately it's not for long term. It could lead to leaky gut, to gut upset. It does lead to sun sensitivity and potentially also could lead to yeast overgrowth, again, if it is used long term. Then we have ivermectin topical, and it does target Demodex mites and calms inflammation. It can cause mild irritation or dryness. Then we have a second group that is vasoconstrictors for redness, and this group includes brimonidine and oxymetazoline. And the goal of these substances is to narrow small blood vessels in the skin to temporarily reduce redness. The side effects actually do happen, and it's a rebound redness, and it's a very unpleasant side effect. Also, of course, mild irritation. They can cause mild irritation. The third group is a little bit of overlap with the first group, and that's anti-inflammatory skin renewers, and that's azelaic acid. Azelaic acid is great. It actually works on calming inflammation, on making the skin texture smoother, and reducing bumps. But honestly, it often doesn't work. By itself, it doesn't work as well, and it may cause stinging or dryness in sensitive skin. Then we have biologics, which are not that widely used for this problem. What they are these advanced medications that block specific immune pathways involved in rosacea's inflammation. So the status of them, they're more experimental because the risks of them and the way they work, they may include immune suppression. Then we have another big group is light and laser therapies. It's a little bit of an expensive treatment, and the goal here is to collapse visible blood vessels, reduce redness, and treat the thickened skin. The limitation, aside from the fact that it's expensive, also results are often temporary because new vessels can form if the underlying inflammation is still active. Then a special mention, very interesting, this Refacamine, and it's off-label. So what it is, it's an antibiotic that is approved for gut conditions like IBS and traveler's diarrhea, not rosacea. And it has been used in the studies where people had both rosacea and they were found to have SIBO, and it has shown skin improvement. So it has shown an improvement of their rosacea. But it's not FDA approved for rosacea per se. It can, obviously, it's an antibiotic, so it can disrupt the gut microbiome if overused. And it can or should only be used if SIBO is confirmed. So what is SIBO? SIBO is a small intestinal bacterial overgrowth. And when it is confirmed and under medical guidance, then it could be used. And this is a perfect time to segue into functional medicine. So let's look at the functional medicine perspective. So rosacea from the functional medicine perspective is, of course, the sign of deeper imbalance. And common root drivers here include, number one, and the biggest one, is gut imbalances. And there are problems with gut microbiome, which is gut dysbiosis, or just inflammation in the gut. And that often shows up in the skin. And component of leaky gut, especially overgrowth of bacteria, has been one of common causes of rosacea. And as mentioned above, it is called SIBO. And the gut component is the main cause for many cases of rosacea, not all of them, but for many of them. It is hard to treat because it takes time to rebalance the gut. Another cause from the functional medicine standpoint is food sensitivities. And we're talking here dairy, gluten, sugar, alcohol, and sometimes even healthy foods like tomatoes that can drive skin inflammation. And food sensitivity testing, or at least elimination diet, is necessary to be able to diagnose that. Histamine intolerance is the next one. Too much histamine or trouble breaking it down can trigger flushing after certain foods or drinks, especially wine. Then again, we talking about skin microbiome shifts. So here we have an overlap of both functional and conventional medicine, where again overgrowth of Demodex mites or imbalance in skin bacteria can definitely trigger or worsen symptoms of rosacea. Then we have hormonal changes such as perimenopause, postpartum shifts, or stress-related hormone changes that can make skin more reactive. And of course, stress, because stress leads to changes in the blood flow. It leads to changes in immune responses and alters our skin barrier health. And basically, your skin literally feels the stress. So that brings us to what can we do right now? What can we do about that? So if you're living with rosacea, here are a few steps that you can start today. First of all, track your triggers. Keep a flare diary to spot patterns. And you may discover surprising links between what you eat, between your environment and your skin. Next, adjust your diet. Temporarily reduce sugar, gluten, dairy, and alcohol to see if symptoms improve. For some people, these changes alone make a dramatic difference. Next, support your gut with comprehensive testing. Like in our clinic, of course, we do a full comprehensive stool test, and we look at the balance of beneficial and harmful bacteria. We look at signs of small intestinal bacterial overgrowth or SIBO. We look at yeast and parasite overgrowth, at the levels of inflammation in the gut lining, at the digestive enzyme function and nutrient absorption markers, and so on. So when we have this detailed mapping, that leads us to or helps us to pinpoint hidden imbalances that may be driving skin inflammation. And that way we can design a personalized treatment plan that is personalized and tailored specifically to the patient. So next big one is be gentle with your skin and skip harsh scrubs and over cleansing, because that's not the issue here. You don't need to over cleanse. And another important one, of course, is manage stress, because good sleep, breathing exercises, mindfulness, they're not just for your mind. They help your skin as well, because again, it's the nervous system that triggers the flushing. In conclusion, your skin isn't the enemy. It's just a messenger. If you're interested in exploring functional medicine for your skin issues, we usually recommend starting with the gut. Our Gut Intensive program is a 6-week plan that includes a consultation with me, advanced comprehensive gut testing, as I mentioned earlier, a personalized treatment protocol based on your results, and 4 follow-up visits to guide your progress. This program is available to residents of Massachusetts, California, New Hampshire, and Vermont. And you can learn more by visiting our website at mindfulmedicalfunctionalclinic.com or calling us at 508-444-6989. And as always, I recommend scheduling a 15-minute free discovery call before getting started. And the link to our website is in the description of this video. Thank you so much for watching. I'm looking forward to reading your comments. Until next time, bye-bye.